There are various types of joints in the body. One of the types of joints are called fibrous joints. Fibrous joints are joints between bones, and there's not any movement with the joint. It means it's two bones joined together and stuck there permanently. Fibrous joints don't allow for any movement. And so an example of that are the sutures of the skull. These little things that look like jagged lines or sutures, where this parietal bone, for instance, grew into this. Do you know what bone this is called? Temporal bone. And they grew together, and there's a little jagged line between them. Those lines, by the way, disappear with age. So when you get old, you can almost not see the lines at all. And the younger you are, the easier it is to see the lines. So that if they find a skull laying somewhere, they can tell how old the individual was by how well they can see these lines. There's a science to it.
Does that mean Fred's not very old?
No, he's still pretty old. I mean, it's a lot more distinct the younger you are.
Okay.
If you look at that real skeleton that I passed around, you can really see those joints. There's like almost space between them, because that's a child's skull. And a baby has big open spots between the bones. Let's look at a baby's skull. Want to look at a baby's skull?
Sure.
There we go. You can see, look at there's space. There's a lot of space there, and there are soft spots where the bones haven't grown together yet. There, and especially on top, right there. We call those soft spots fontanelles.
Are they actually soft? Like, can you feel it?
Yeah, you can push your thumb right there, and it will be soft. And so they're prone to injury if they get poked or something there. That could go right down into the brain. And right here and right here. So you got to be careful. But those pretty quickly grow together, and then you get the sutures. There's the posterior fontanelle, anterior fontanelle, the sphenoid fontanelle, next to the sphenoid bone. Isn't that great? Now, most of the joints aren't like that. Most of the joints have movement, allow for movement. We call them synovial joints. Now, here's an example. Here's a bone here. This might be like a finger joint or something. You have bone here. You have bone here. Then you have a membrane. This dark blue is a membrane which surrounds, it attaches to the bone on one side and attaches to the other bone on the other side. In the membrane, it's 3D, so it comes out at you. It goes all the way around that membrane. And it holds fluid. It holds liquid. That's liquid right there. And the fluid is under very high pressure, you see. And so these bones usually don't touch one another. There's usually space there that's filled with liquid. The liquid is called synovial fluid, and it's secreted by cells that are on this membrane. These cells that are on this membrane secrete synovial fluid into this space. So there's just a bunch of fluid in the space, and that means the bones never touch. But if you jam your finger or something, you ever jammed your finger? Then that's when the bones are compressed, and those bones whack together, you see. And there's cartilage protecting them. But the cartilage, when the cartilage hits one another, there's a bunch of nerves there in the cartilage, and it hurts really bad. And if it could damage, if you do it bad enough, it could damage the cartilage. Pieces of cartilage could fall off and be floating around inside the joint cavity. That can be bad. If you have loose cartilage in a joint, usually the joint stops working. If you have loose cartilage floating around in your knee joint, you often can't straighten your knee because the cartilage is in the way. And the doctors have to go in there and cut it out. If you try to straighten it, it hurts real bad. That little floating piece of cartilage is pushing up against the other cartilage that's in there. So we call that a synovial joint. You ever cracked a knuckle? You know what I'm talking about?
Yep.
When you're young, you can crack them better than when you're old. Basically, if you take these two bones and you pull them apart from one another, it's kind of like pulling a plunger off the floor. You know, if you have a plunge and stuck to the floor and you pull it up and it goes pop. It's like whenever you crack your knuckle, it's like pulling those bones apart from one another, and there's a pressure, a negative pressure there. When you pull it across, it's like pops loose from. I mean, it doesn't break the joint, but the liquid there, the bone pulls away from the other bone, and there's open area in the joint there, and when it pulls apart, it makes a popping sound.
Is it bad for you to do that?
The research on that isn't. They aren't certain. Some people say, yeah, it's bad. Some people, what happens when this cartilage wears down, you develop arthritis. And some doctors say that cracking your knuckles a lot will give you arthritis. But it might be that those doctors just happen to have patients who crack their knuckles a lot and also developed arthritis, and so they're making a connection where that might not be the reason why they got the arthritis. It might be because it's in their family, or they have other problems, or they just happen to be athletes and they jam their fingers a lot.
Yeah.
And they developed arthritis, and the doctors knew that they cracked. You can make a false assumption there. They're trying to get research on it, whether cracking your knuckles actually helps cause arthritis or not. But they're not sure about that, last I heard. I would say don't crack your knuckles just in case it does. But I've never heard, every once in a while there'll be an article about it in one of those magazines that says, oh, there's a little bit more evidence for or against it. So here's the knee joint here. And the knee joint's a little more complicated. There's fluid here, but there's also fluid behind the patella, the kneecap. And the fluid goes all the way up. And there are little extra membranes that hold fluid too. They're called bursa. A bursa is an extra membrane, a little sac of membrane that sits in or around the joints in different places and holds fluid as well. There's a common infection that people get. It's called bursitis. You ever heard of that? It's when one of these bursa are full of bacteria or for some other reason swollen up, and it hurts really bad. Bursitis. Have you ever heard of an arthroscopy? What in the world? Arthroscopy is when they take a camera and they stick it into your joints and look around. And so here's just kind of a
Arthroscopy is a procedure used by physicians to view, sample, or repair tissue in a joint cavity. The physician makes a small incision in the skin and joint capsule to insert a small tube-like camera. This arthroscopy of the knee shows an examination of the lateral meniscus.
So he's moving the camera around, and this is what the doctor's seeing right here. And above is how they're showing it pan around. So if you're an orthopedic surgeon, you do this all the time with athletes. You go in their knee and scope it. You ever heard them say they're going to scope your knee? That's an arthroscopy. They stick a little camera that's on a little needle or pin and stick it in there, real fine, tiny little cameras. Little tiny cameras have made a world of difference in medicine. There's all sorts of arthroscopic surgeries that can be done. It used to be to do a surgery on the knee and look in it, they'd have to cut it open. You'd have a big scar and they'd open it up. It'd take weeks to heal. And if they just make one of these little pinpoint cameras through a little tiny hole, they can still look around. They can even stick little instruments through little holes and fix stuff, and you heal real fast. You might only take you a week to recover, or a few days, rather than 6 weeks. like it used to. Little arthritis video showing you what arthritis is like. The skeleton.
Within the skeleton are many freely moving joints that allow the bones to rotate or move back and forth within a certain range of motion. The knee joint is a good example of how bones articulate with each other to allow movement. The ends of these bones are covered with a smooth, tough material called cartilage. Cartilage reduces friction between the bones and acts as a protective cushion. Surrounding and lining the joint is the synovial membrane, a tissue that secretes a thick, slippery fluid. Synovial fluid acts as a lubricant within the joint. In arthritis, the tissues of the joint become inflamed and can deteriorate. The two most common forms of arthritis are rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is a disease that involves inflammation of the joint. The synovial membrane becomes inflamed and may damage the cartilage in the joint.
A bunch of damaged cartilage.
Osteoarthritis most frequently occurs in the weight-bearing joints like the knee and hip. This form of arthritis is primarily due to the wear and tear on joints. Over time, the cartilage in the joints deteriorates, leaving the ends of the bones exposed and rough.
Most old people have arthritis of some sort just from a lifetime of walking around, especially if you're a runner or a basketball player, football. You're going to probably have arthritis because you've been jarring the bones a lot and they hit together and rub that cartilage every once in a while, and over doing that for a lifetime you wear away that cartilage and then it hurts really bad. And so there's different medications you can take to help arthritis, but it's a pretty common
Is there
thing.
like an artificial material that they could put in there to stop that?
Yeah, they're working on stuff like that. That's a good question. You know, it seemed like you could just cover it up with something else. They can do a whole knee replacement where they cut the bone here, and they cut it here and there, and put a hole like a plastic or some sort of metal knee in. And it works pretty good. And a lot of people get that done if they have really bad arthritis pain. I don't know about, we'd have to ask an orthopedic surgeon or something what's the latest in replacing the cartilage and that kind of thing. I'm not sure what they can do with that, but the field has come a long way in the last 20 or 30 years. So hopefully by the time you guys get old, they'll have better things they can do. One of the promising things is called stem cell research. You ever heard of stem cells? If they can figure out how this works, they take some stem cells and squirt them in there, and it grows back the cartilage. And one of the ideas is to get some of your stem cells when you're just a fetus, and put them in a freezer, and then when you get old, take them out and squirt them in there, and they ought to grow back into cartilage, like in cartilage that's real young. So you could have a young person's cartilage right there. That's one of the things they're trying to do with stem cell research, and they'll probably figure out a way to do that one of these days. There's all sorts of types of joints. They're listed on the bottom of 163. We have ball and socket joints. That's, well, you can see it's like a ball fitting in a socket. The femur fits in the hip, and it allows for all sorts of movement. You know, your shoulder is a ball and socket joint. You can get movement this way, and up and down, and back and forth, and around. A ball and socket gives you a lot of movement. It's kind of like a trailer hitch. You know, you got that ball in there, and it can spin around all sorts of ways. A condyloid joint is like ones in your fingers here, and it gives movement kind of across this way. You can see how the arrows there show the different forms of movement that are allowed by a condyloid joint. A gliding joint In the carpals of the hand, you have gliding joints. It's kind of like two flat surfaces that can glide along. A hinge joint just kind of moves in one plane. Your elbow is a hinge joint. It's like a hinge of a door. It can go back and forth, but that's about the only thing it does. It kind of moves in one plane. It can't also move this way. It moves just up and down. A pivot joint just can spin around. Your atlas and axis are like that. Your atlas sits on your axis, the top two vertebrae, and the atlas can spin around the axis. And then here's another weird looking one. It looks like a saddle on a horse. It's called a saddle joint. And that's what your thumb has, and it allows for a variety of movement too.
What does the phrase double jointed mean in like anatomy?
Good question. Good question. Double jointed really means that you have a joint that allows more movement than normal. So my elbow goes like this. If you're double jointed, you can actually go further down with your arm. You know what I mean? So double, it doesn't mean there's two joints. I don't know how they got double. It should just mean wide jointed, because you can actually do the movement farther. Like normal people, the joint between for your finger, it goes back that far. But if you're double jointed, you can bend it back even farther. So it just depends. That's all genetic on how the joint is constructed. So some people just have the genes where they can bend their fingers back farther. There's a ball and socket joint. This just kind of shows how it moves. These videos are pretty lame here. See, here's an elbow hinge joint. You know, you can pretty much see what a hinge joint does. McLean. Oh, yeah? Okay, some words you need to know for movements. Okay? Abduction, adduction. Abduction, adduction. Ab, going away. I always remember add, you're adding to the main part of the body when you adduct something.
Like when you're being abducted, you're getting sucked up.
Abduction is taking it away from the body. Adduction means adding it to the body. So, extension, flexion. If you extend, you're spreading your two bones apart from one another. If you flex, you're coming back towards. Extension, flexion. Sometimes they say flex your muscle, and you go, extension, flexion. So that's this, and with the leg too, extension, flexion. And then with the hand, you have extension, flexion is this way, and hyperextension is that way. Because you can go two different ways, see, with the hand. So they have to extension, flexion, hyperextension. So flexion, hyperextension. And then dorsiflexion, extension is putting the foot out. Dorsiflexion is pulling it up like this. Plantar flexion, pushing it down like this. Dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. Circumduction. Circumduction. Or going around like this with the legs. That would work too. That's circumduction. Like going in a circle. We use these two terms in golf a lot. Supination, pronation. Supination, pronation. And the way I always remembered that was, if you're going to hold soup, you got to be like this. And if I'm going to give somebody 5, I say, hey, what's up, pro? And I give them 5. That's pronation. Supination, pronation. So in golf, you're supposed to, at times, with your right arm, after you hit the ball, you're supposed to pronate your right hand. So make sure you pronate your right hand. You got to turn it over. Another lame video.
That's it. Sound effects are going.
Thank you. Okay, E version is going out. Inversion is going in. E version, inversion.
Like Elvis.
Like dummy class.
It's a dance move we used to do in the 80s. Protraction, retraction. Protraction, retraction. And if you work those two together, elevation, depression. Elevate your shoulders. Depress your shoulders. Raising something up, elevation. Going down, depression. So you need to know all those joint movements too. That'll be on the multiple choice part of this test. I'll show a picture of a guy going like that. And you got to choose which one it is. What is that?
Pronation.
Pronation? I'll get me going like this. What is that? What am I doing with my shoulders?
I don't know.
Elevation.
I shaped this one.
You shared that with me at least 5 times. I'm so happy.
I'm so proud of myself.
Okay.
I didn't even cut my nose.
So, you are to read 7.13. You came in late. There's a quiz over the skull again tomorrow. Different quiz. Same skull, different quiz. Because I thought everyone did kind of poorly on that quiz. So for the rest of the time here, we're working on IDs, or you're studying for that quiz that's going to be tomorrow.